next is Dr. Christina Glick, and let's welcome her. She has practiced neonatology for over 30 years before retiring and opening the Mississippi Lactation Services, a freestanding breastfeeding clinic here that's located in Jackson. She has had a career-long interest in breastfeeding for those little fragile preemies, and now even to a more broader context of infants and family and community health. Her practice is based on the principles of family-centered care, and the clinic's environment is designed to promote a relaxing and healing setting. She has 3 grown children, their spouses, and 3 grandchildren with whom she has the luxury of enjoying in her spare time. So let's please welcome Dr. Glick.
Thank you. Thanks. And I don't know that my video's on. I hid myself. Can y'all see me? Okay, great. Thank you.
We can see you. You're good.
Thank you. So I'm so glad to be here, and I'm excited to get to spend a little bit of time talking about breastfeeding with some new and expecting moms. It's a great time to get some early heads up about some breastfeeding issues. That's the best way to ensure breastfeeding success, is to know some stuff about it before you're actually trying to do it right after your baby's born. So I did practice neonatology a long time, and I loved my neonatal practice, but I tell y'all, it's the greatest gift for me to be able to do what I do now. It is so much fun to be able to really practice medicine in this sort of safe and healing environment now in my clinic. I just, I thought I was an intensivist through and through. And then now that I'm practicing breastfeeding medicine, it's just great fun. So I look forward to seeing each and every one of you and your babies. If you have any breastfeeding issues, I'd love to help you out. So I was going to just talk about some real basic stuff about breastfeeding. A lot of it you'll probably already know, but I have my favorite little saying is there's only one rule to breastfeeding, and it applies to everyone who breastfeeds. And that rule is that you have to get milk out of your breast to be able to make milk. And so it's all about supply and demand. And the reason that's the only rule that applies to everyone is because breastfeeding is such an individual relationship between a mother and her child that there are as many different ways to successfully breastfeed as there are mother-infant dyads. And not only that individual relationship, but breastfeeding changes from day to day, week to week, and month to month. So there are many stages of breastfeeding. So what's true in the first week is no longer true necessarily in the second week or the second month. And so I thought I would sort of divide what I was talking about into these sort of stages of breastfeeding so that you can kind of get a general idea of what the normal sort of progression of breastfeeding is. So I'm going to I divided it up into 3 different stages. Initiation, which I'm calling, the first weeks of breastfeeding. And truly, breastfeeding initiation takes almost 2 months. And so it's not like the day your milk comes in, your breastfeeding is established. And then maintenance breastfeeding is probably from the 2nd or 3rd month on through your whole breastfeeding experience until you decide to enter the final stage, which is the weaning stage. So let's talk about initiation in that first couple of days of breastfeeding, because that's really what there's a lot of magical stuff to breastfeeding, but those first couple of days are really, truly magical. And I will bring up one thing before I even start on this. There's, we have all these great recommendations for breastfeeding. And one of the most common things I hear from people is, well, what if that doesn't work for me? Like, I'm planning to have this beautiful vaginal birth and then have my baby never separated from me, and I'm going to have her with me on my chest, you know, for that first hour. And then you have to have an emergency C-section. And so and then my baby's separated. What do I do then? Is that going to ruin my breastfeeding forever? And nothing ever ruins your breastfeeding forever. There's always a step back position that we can always do some measures for rescuing breastfeeding if things don't go perfectly, either in the first day or in the 6th month. So there's always another way we can approach things. But one of the cool things about breastfeeding is that magical first hour. So it's called the sacred hour, let's just call it the sacred hour. And that's when we want to have all mothers and babies together in unseparated time until the baby has their first successful breastfeeding, ideally within the first hour to hour and a half. And babies go through a 9 stages during that period where they don't immediately just go to the breast and start breastfeeding, but they do what we call the birth crawl, where the baby's placed on the mother's abdomen and they will actually themselves of their own volition crawl to the breast and begin to explore the breast through licking and smelling, and then eventually will gradually latch on. And the last stage is actually getting the first breastfeeding done, and then falling into a deep, deep sleep. And usually the mother and the baby both fall deeply asleep after that first breastfeeding. And one of the reasons this is so important, why it's called sacred, is because if this stage can be accomplished, this really cements a foundation for successful breastfeeding. And there's tons of data that if you can do this, it really makes the whole rest of the breastfeeding process easier. The baby then imprints on how to breastfeed from that first feeding, and it increases the rate of breastfeeding success, and increases the duration of breastfeeding as well. So it's really, really important. And so remember, that first milk that you make is colostrum, and it is packed full of stuff. I mean, it's chock full of protein, really important immunologic proteins like antibodies, but other immunologically active proteins that really prep the baby's gut for preparing for feeding when the milk comes in on the 2nd or 3rd day. And you know, it really gives the baby a good head start in fighting off infections, in preparing the gut for all the functions it will have to accomplish in the first couple of days. I mean, it's a huge transition from in utero to the extrauterine environment. So as the milk comes in, usually it sort of comes in like a ton of bricks. So you don't feel like there's much there. And when you're making colostrum, it's usually a few teaspoons a day. So you may not even make more than about 1 ounce to 1.5 ounces of colostrum in a whole day. And so it's not a big volume, but it's packed full of really important stuff for that baby to get. So every drop is really, really important. And then as the baby transitions to getting the milk to come in on the 3rd or 4th day, it usually comes in pretty quickly. Your breasts get really heavy and full. And one of our goals is to have the baby breastfeeding frequently to prevent severe engorgement. So we don't want you to feel like your breasts are bowling balls. If we need to prevent that, and it's pretty uncomfortable amongst other things, but it also makes it hard for the baby to latch on. So as that milk comes in, it gradually thickens and looks more like milk. The colostrum's real thin and watery looking, and then gradually the milk looks thicker and heavier. Oftentimes it kind of gets a yellow color, but you know, breast milk comes in all colors. I've seen green, blue, pink, all colors of breast milk, and that's normal for it to have all variations of color. And so there's nothing wrong with it if it isn't just nice and pearly white like we see cow's milk in the milk jug. And so the first week is really about establishing the beginning of milk production. And oftentimes, once you get through that first week, the second week can be really difficult because the baby usually doesn't really wake up and get real active until that second week. And then all of a sudden, the second week, they're starving and demanding, and you're already exhausted. It's a pretty tough transition. But the light at the end of the tunnel is somewhere between 3 and 6 weeks when the first big growth spurt happens. And it's a huge developmental leap. It's hard time. And usually it lasts from 3 to 4 days. Sometimes it can go on for a week, where you've had this nice baby that's been a compliant, good breastfeeder. And then all of a sudden he's starving and screaming and constantly wanting to eat. And you think your milk is dried up because your baby's not getting enough milk, which is what is happening during the growth spurt. They are nursing frequently to drive your milk supply. So during this growth spurt, the milk supply about doubles. So you go from about a half an ounce to an ounce and a half of milk every 2 to 3 hours to up to the full amount of normal breastfeeding volume, which is an ounce an hour, or 24 to 28 ounces in a 24-hour period. So if you were bottle feeding breast milk, it would be 2 to 3 ounces every 2 to 3 hours after that first month growth spurt. So in the first month, the volume is lower than that. So we're used to formula-fed babies who will take 2 to 3 ounces. Breastfed babies in the first month take much smaller feedings. So they may be taking, an ounce to an ounce and a half. And usually, and I would prefer to have you breastfeeding, but lots of women have to pump and bottle feed, and that's okay too. It makes it a lot easier if babies aren't quote unquote overfed in those first few bottles that they get. So at the month growth spurt, a couple of things happen that really change. The baby begins to skip feedings at night. So instead of waking up, the normal breastfeeding pattern is somewhere between 10 and 15 feeds in a 24-hour period. And then they will drop down to more like 9 to 12 feedings. And usually they skip a feeding or two at night. So you begin to get a little bit longer sleep. They usually don't stretch out their feedings too much during the day. At this point yet, they quit pooping with every feeding. So they have 1 or 2 good big poops during the day, and everyone always panics about that because they tell you in the hospital they want your baby pooping all the time with every feeding. And then when they suddenly quit pooping with every feeding, it's panic time. Suddenly my milk is going away. This is normal when the milk matures, that it's just processed differently by the baby's body. So they quit pooping quite as often. And then usually the feedings are shortened as well. So in that first, beginnings of breastfeeding, we think babies usually feed somewhere between 10 and 20 minutes, and then they'll gradually cut down the length of time of the feedings to as short as 5 to 10 minutes sometimes. And that's a real dramatic change, and it's a real scary change for a lot of women when they really do these short feedings. So by 6 to 8 weeks is when we recommend that if you want to start pumping, you can do some pumping. You can start using the bottle some. And I actually recommend absolutely beginning to use a bottle before the baby enters the 3rd month. Oftentimes breastfed babies, if they're not given that bottle before that 3rd month, they will refuse it. And it's really, really hard to teach a baby how to take a bottle if they haven't done it by that time. So 3 to 6 months is sort of usually a nice little honeymoon period for your breastfeeding, because you've kind of gotten over the original difficulties of breastfeeding. You're kind of settled into a routine. You are getting to know your baby really well. You kind of know what's going on, kind of relax and enjoy the breastfeeding journey. And we recommend introducing feeding somewhere around 6 months when the baby's ready. And I'll quickly talk about baby-led weaning, which is a breastfeeding way to introduce foods. It's not typically how we've done things in this country, because formula-fed babies are at risk for developing food allergies when they start eating a myriad of different foods, because if they've been formula fed, they have a very limited antigen exposure. But breastfed babies are exposed to everything you're eating. So what is on your plate is safe from a, allergic standpoint, for your baby to eat. So we encourage babies to start feeding themselves appropriate foods when they're ready. So that's baby-led weaning, and that's something that's really popular these days for breastfeeding moms. And then after 6 months, and we recommend exclusive breastfeeding for 6 months, where babies get nothing but breast milk for at least 6 months, and then continuing a breast milk diet as part of their diet until mother and baby are ready to wean. And we call that, the natural term of breastfeeding is when the baby and mother naturally decide to wean. And that's an individual choice for everyone. And some people enjoy breastfeeding through toddlerhood. In this country, we tend to sort of terminate breastfeeding in the second year of life sometimes. So somewhere between 12 and 15 months is sort of our standard time to wean. But that's widely variable around the world, and there is not a right or wrong way to do that. And by 6 months, your breast milk is pretty rock solid steady. So you have more flexibility in sort of how you want to pump and breastfeed. And if you're going to breastfeed beyond a year, your supply is pretty much solid, and you have lots of flexibility to manage your breastfeeding / pumping plus / lifestyle as you choose. I think my time's about up. I'm not going to really talk about weaning because y'all are really thinking about starting breastfeeding, but weaning is a whole different topic that I spend a lot of time with my patients around weaning. It's a really important part of breastfeeding as well, so that we do it gently so it's not traumatic for you or your baby. And I'll mention real quickly about the COVID vaccine. There's decades of animal research about the mRNA vaccine, which is what most of the COVID vaccines are. This work was being done in preparation for a pandemic. The mRNA vaccines that were tested in the animal model weren't for COVID, but they were mRNA, which is this technology. The mRNA data is that it's safe for gestation and breastfeeding. We've been recommending vaccine for breastfeeding mothers for a few months now. The Academy of Breastfeeding Medicine, the World Health Organization, and finally the CDC came around and recommended it for breastfeeding mothers and pregnant women just fairly recently. They were a little behind the rest of the recommendations, but the mRNA vaccine actually, the protein that is the mRNA, that is the vaccine, sits locally in your muscle. It doesn't get through to your milk. We don't even think much of it gets into your bloodstream. So it sits right in the injection site. What gets into your breast milk is your body's natural antibody response to the vaccine. So we think there's good data. No, we know there's good data that the antibodies are crossed into the breast milk and will provide protection for a breastfeeding baby from an immunized mother for COVID. So we do gently recommend that you get that if you're breastfeeding. So thank y'all so much for being here. It's really nice to spend some time with you guys, and I'll be hanging around for the question and answers at the end.
Thank you so much, Dr. Glick. That was a lot of really great information.